March is Colon Cancer Awareness Month. It's an important reminder considering about 50,000 people die from colorectal cancer in the U.S. every year. Recent studies show this deadly disease hits certain demographics harder than others. And that's why one Utah man is sharing his story. For Your Life, Your Health, here's Allie Davis.
For Jesus Moreno,
yeah, you're fast. How did you learn?
It's a long time in the kitchen, you know, had to learn to be fast.
Some things are easy to talk about, like cooking. He's a chef for Blue Lemon in Salt Lake City.
You feel really good about making food for other people, you know.
Other topics are not so easy.
You just don't want to talk about it, you know.
Like regular colon screening. In October 2020, Moreno was unexpectedly diagnosed with colon cancer. He was just 39.
I started feeling kind of dizzy, kind of tired. I was losing some weight.
He also noticed blood in his stool, all typical signs. After months of chemotherapy and radiation,
really tiring, really tiring.
Moreno had surgery to remove part of his colon.
I'm still here for my family, for myself.
Recent studies show young Hispanics have the highest rate of new colon cancer cases. Yet, Hispanic Americans are less likely to get screened for colon cancer than Caucasians or African Americans.
We are Hispanics, so we don't like to talk about that.
Let's face it, bathroom talk is uncomfortable for anyone. Dr. Nathan Merriman, a gastroenterologist at Intermountain Healthcare, tells people to blame the conversation on your doctor.
My gastroenterologist said, I really need to talk to you about this.
Especially if you have a family history of colon cancer. In that case, people should start colonoscopy screening 10 years before the age of their family member's diagnosis. For those of average risk, the recommended age for a first screening is now 45.
Colonoscopy is still the best way to help prevent colon cancer by removal of the precancerous polyps before they turn to cancer.
Merriman says if you recognize the signs, don't delay care.
As soon as symptoms show up, that's when you really need to seek care.
In Moreno's case, it made all the difference.
It can save your life. It did save mine.
For Your Life, Your Health, Allie Davis, KSL 5 News.
Thanks, Allie. Dr. Merriman says Intermountain Healthcare saw an almost 50% decrease in colorectal screenings during the COVID-19 pandemic. We've reported they have started to see an increase in cancer cases. So he urges those who put off their colonoscopy to make it a priority before it's too late.